Welcome to Seniors on the Move. My name is Karen McKenzie. We have a very interesting show for you folks today. We're an aging population, and we expect and deserve to have good care. And I'm lucky to have Lynn Alexandrowicz with us today. And I'm just going to read a little bit to you about her. Lynn Alexandrowicz is a national certified dementia practitioner, a consultant for accessible home health care, which is a private pay, and also she is a consultant for the Shrewsbury Nursing and Rehabilitation Center and Outpatient Clinic. That's a mouthful, isn't it? Which is a family-owned business, and she's going to talk about that a little bit. Lynn's career spans many decades in the healthcare arena, from the HMO industry as well as assisted living, hospice, which we're all interested in, especially today, hospital, adult day healthcare, nursing homes, and home care. So we have a lot to tell you today. So let us start with accessible home health care.
Yes.
What is it?
Thank you, Karen, for having me as a guest.
Pleasure.
I appreciate it.
Pleasure.
So I have been in the industry, as I said, for many decades, and now I do consulting for the home care industry as well as the nursing home industry. So Accessible Home Care is a private pay home care agency with offices located in Auburn, Mass. We're going into our 5th year of business. We are female-owned, which is nice.
Nice.
And one of the co-owners is a nurse, RN, BSN, with her master's, who has been in the industry for about 40 years, working for national home care agencies. And her and so Ruth Langway and Martine Beaumont are the owners, and they used to work together, and they got together as friends also, and decided that they wanted to own their own company. So they purchased a franchise that's based in Florida. There's only about 25 up and down the East Coast. We're kind of the only ones in this marketplace, which is nice. So we're a private pay home care agency, and what that means is that insurances do not pay for the care. So you would pay private funds for
None of it at all?
No. The only insurance that would pay if someone does have long-term care insurance, and that would be depending on what policy they've had and how much they purchased on a policy years ago. A lot of that does cover sometimes assisted living care, or it covers home care or hospitalization, or a combination of all three. So it depends on what type of policy they had.
Sounds very complicated.
It isn't. There's about 5 different companies in the nation right now that have long-term care insurance companies. So we work with them in the coverage, and they pay a certain percentage towards that person's home care.
And it usually is quite expensive, I would think.
For home care or long-term care insurance?
Long-term health care.
Long-term care insurance runs the gamut. Usually you purchase that when you're in your 50s and 60s, and then start utilizing it when you're in your 80s and 90s, depending on your health care situation. So it's better to start early. Absolutely.
If you're going to have
Absolutely.
that. All right.
So the home care, how we work is that we have nurses that oversee care, even though we're private pay. We have nurses, we have certified nursing assistants, which are called CNAs.
Yes, yes.
We all have our own alphabet soup. So, and then we have home health aides, which are certified home health aides. And they go through a certain course of schooling, get their certification. They have to constantly be doing credits throughout the year. So CEUs, it's considered, doing their credits for continuing education throughout the year. And then we have companion care too. So at Accessible, we can come in and do a live-in, which would mean that someone would physically move into your home and live there and take care of you 24/7.
Wow.
Which is nice. So keeping you at home, if that's that client's choice or family's choice, is to keep them at home as long as they possibly can. A live-in is something that we recommend. Also, we have what they can call a 24/7 care, which means that you would have probably 2 different aides in there doing each a 12-hour shift. So somebody would be there all the time, 24/7. And then we go down to a minimum of 4 hours that we can go in and help. And the aides not only go in and help with activities of daily living, but which means that they help them dress, shower, shower, bathe, get dressed, also do light housekeeping, light meal preparation, be able to drive them to appointments if needed, follow-up visits, what have you. So it's a lot than just helping them shower and bathe and toiletring, as
Sure.
well as dressing. There's other activities that are happening during there. And a lot of it's a socialization as well as
Yeah,
security,
that's true,
safety
too.
issues.
Having someone to talk to.
Right, and so many people live by themselves as they age, and their families have, dispersed throughout the U.S. So you might have a child that's in California, they can't keep on flying back and forth, but mom or dad wants to stay here in their own home. So that's an option. That's when they call us. We work with different case managers in the hospital settings. We work with private life care managers. And word of mouth, as well as we work in assisted livings, nursing homes. When people are being discharged from nursing homes, they contact us, or the family contacts us, or the nursing home staff contact us. And we sit down and we talk with the family to see what the best option is. And we develop a care plan that we oversee, constantly updating that care plan and overseeing as someone's progression might,
Let me ask you this. Private home care, private pay, is that what they call
Right,
it?
private pay.
In your experience, is that usually less expensive than being in a nursing home? Or is that too general a question?
No, it depends. It
Curious.
depends. Yeah, it depends
It
on
can
what.
be less?
It can be, absolutely, depending on what services you're having and, versus, if you're doing maybe 3 days a week at 12 hours a week versus a live-in
All right.
or whatever. But I think we sit down and really try to work with them financially also to see what would best suit. And again,
Yeah.
it might not be a permanent solution, but it could be a temporary solution. So we
Sure.
might be, we've had some cases where we're there for a year or two, and then the next step is their, diagnosis progresses, that they move into the next phase, which would be going into a nursing center or going into hospice in their home, or hospice within a nursing center.
What about finding home health aides today in this
Right, like
in this
every
reality
industry,
today?
every industry. COVID did a lot for, unfortunately, destroyed a lot of
know.
things, including lives, but really ran the ruckus in the healthcare industry. So what's nice is we've had a lot of aides that have been with us for quite some time, and also worked with Ruth years ago at different agencies that she worked with, so they kind of followed her, which is nice. And then,
nice.
we're always looking, so we're always looking for aides versus, Indeed and recruiting, constantly recruiting.
So do you train aides, or do you want people that are experienced?
We like experience, but we will also train them. So we have some that
will.
come in
Oh,
with their
that's
home
great.
health certification, and then we help them to move to the next step, which would be a certified nursing assistant. And then
The
we've had some
CNAs,
CNAs who
yeah.
have gone on to school, continuing and get their LPN.
Yes,
And
yes.
then maybe go on and get their RN. So, which is kind of
That's
nice.
wonderful.
But we service the Central Mass Marketplace, and which means Worcester and all the surrounding towns. We go as far east as the Framingham Market, down to the Milford area, out to the Brookfields, and then up into North County, Leominster area, Sterling, Leominster Marketplace. If it's a live-in, we'll go anywhere in the state. We do have people who live down the Cape that we service with a live-in aid, so which is nice.
All right.
And then the other option for home care is a certified, the VNA. A lot of people call it the VNA, Visiting
That's true,
Nurses
too,
Association.
yes.
So those are Medicare certified agencies, and Medicare and Medicaid and insurances pay for that care, but it's usually very short term. So if you're at the hospital, and I always use the scenario, let's say you fell on ice, you broke your hip, you went to the hospital, had surgery. After you were in the hospital for 2 weeks, they said, okay, you need to either go home, or we're going to send you to a nursing center for short-term rehab. And if they decided to go home, we would then be called in, and we might be there for a month doing, helping them get acclimated, back to getting acclimated to their home, as well as getting back to their baseline. And we work in conjunction with some of the VNAs in the area that will come in and do nursing, physical therapy, occupational therapy, speech therapy. So
Wow, it's so involved.
it is. There's about 300-something home care agencies in the state that are just private held. And then there are also about 400 VNAs in the state, going from the western part of the state down to the Cape.
Now, is part of your job visiting these places, observing or learning?
I work with, my position is more business development and operations. So,
Okay.
and then I work with, I consult for the nursing center, which is Shrewsbury Nursing Center, which has been in the industry for 70 years. It's one of the few family-owned nursing homes now. As you know, most of them are now owned by huge corporations from New Jersey or
Yes.
New York, and they come up and they purchase the nursing home. So we are still family-owned, which is nice. So we're located at on Julio Drive in Shrewsbury.
Yeah, yeah.
And we've been around in existence for 70 years, and we're still privately held, so privately owned by the Flanagan family, which is nice. And we have a wonderful nursing center that has short-term care. So again, the scenario, if you went to the hospital for a broken hip, you had surgery, they recommended that you go to a nursing center for maybe 2 weeks for rehab. So you would probably, you have your choices. I always tell people, advocate for where you'd like to go, because most of them accept most of all the insurances, so you have a choice of where you would like to go. And you would go in and maybe be there for 21 days and have nursing, PT, OT, speech, what have you, and then be discharged home. So that's considered what they call short-term care in a nursing center.
Okay.
The other term that's used is long-term care in the nursing center, which means that you would permanently move into the nursing center and be there living. That would be your home. So,
All right.
and they also do respite. So we all know we all
Oh,
need
wow.
respite in life as caretakers, which we all
Oh,
are.
yes, yes.
And respite would mean, with graduation season upon us and vacation season, people are leaving and they want to make sure that their family member, and if they choose not to have home care go in and take care of the family while they're away, they can go into a nursing center and do a short-term stay, and it's called respite.
Okay.
So they would be cared for in the nursing center, which again, they'd be safe, they'd get their medications, their meals, their socialization, and they'd have, a room that they would be there for anywhere from, 3 days to 7 days.
Wow. Now, looking back, say maybe 20 years ago, what are the main changes that we see in nursing homes? Because they didn't have the greatest reputations.
They didn't. It was kind of a place, unfortunately, that you went and that was it.
And I know there were some good ones,
right,
of course.
So lots of changes, lots of laws have changed, but I think the biggest change that we've seen with the landscape is that at one time there was 400-something nursing homes in the state, and I would say probably 25% of them were privately owned. And now there is probably 300-something nursing homes in the state, and I would say 80% of them are corporate owned. So there's only 20% that is privately owned still. So those changes have occurred, and I think what's important when you're looking at a nursing center, I always tell people to choose three. Choose three that you want to look at if you're planning on long-term care.
Keep that in mind. That's a
Go
good
for a
idea.
tour. Don't make an appointment. Show up, see if you can have a tour. Again, with COVID, it's a little different, but during
Yeah.
COVID time, it was very hard. A lot of times you didn't gain access to the nursing center because of COVID outbreaks or what have you. But go and tour. Look at what the state survey is. Google. I call it Dr. Google. Google everything. So there in Massachusetts, there's a star rating. So
Yes, yes.
5-star being the best, 1-star being the worst. And that can fluctuate. And you usually have state surveys once a year. And they come in and they look from everything from food to nursing to housekeeping to everything. And they're all broken down and rated. And the book is about this thick. So every time that you walk into a nursing center, you could say, I'd like to see your last survey results. And they're open for the public to read through and see what they were rated on.
Oh, if I owned, oh my God, I would be scared. So is it just a day, or do they
So
look-
anytime when the state comes in and does the survey, it can be usually from 2 days to 9 days, depends. And they
Really?
come in with people that have worked in the industry, and now they're surveyors, they call them. They're surveyors, they work for the state of Massachusetts, the Department of Public Health. And they come in and they go through everything, and it's good because it makes sure that everything is where it should be. And if you need to fix things, then things need to be fixed in a certain period of time.
What do you see for the future? Do you feel more people are going to have private pay, or there'll always be some, I suppose,
Right, I
that
think
go to
it's
a nursing
Medicare
home?
and, Social Security and Medicare and Medicaid are never going to go away. And then there's all different types of managed care companies that are out there for insurances. As you know, a new one
Sure.
popped up, a couple new ones popped up in the area recently when it was an open enrollment for Medicare. For the future, I foresee that more and more corporate companies will be buying family-owned nursing centers, which might not be for the best at times. But I find that, the industry is not going to go away. It's only going to have to get better. I think, certain generations, as they age in place and go into a nursing center, playing bingo is not going to be of interest because, it's a certain generation that grew up playing bingo. My generation, is going to be, no, I want my tablet, I
That's
want my
right.
Wi-Fi, I want, a lot of electronics, so I can foresee the landscape changing there. But I think what's nice at Shrewsbury Nursing Center is that we do short-term, we do long-term, and then unfortunately, as we both know and have been, afflicted with family members, and everybody is these days with dementia and Alzheimer's. So we have a secured memory unit, which is wonderful. So that memory unit is for people who have been diagnosed with dementia and Alzheimer's. So again, the staffing ratio is a little different. Activities are geared towards that diagnosis. Color palettes, everything, noise, lights, all that is geared towards the diagnosis of Alzheimer's and dementia. And we have a secured memory unit at Shrewsbury, which is nice. And actually, my mother resides there. She's been,
She does.
yeah, she has, unfortunately, was diagnosed probably about 10 years ago, and is 95 years old.
Oh my
I
gosh.
know. And but the care is very important, and I've been in the industry for so many years that when it was time for my family and I to make a decision of my mom's next step and to go into a secured memory unit that was focusing on someone that has a diagnosis of Alzheimer's or dementia, I chose which nursing center I wanted her to go into, even before I was affiliated with them, because I knew the care was there. I knew it was family-owned. A lot of the boxes were checked for me. And the
Okay.
care has been superb, and even to the point where I'll relay this story that my dad still goes to visit her every day. They don't make men like that anymore.
Too bad.
They've been married for like 71 years.
Oh my
and
gosh.
still in love. And he goes to visit every day, and he was having some dental work done, so he didn't go in one day. And two of the nurses called me separately to say, "Your dad is not here. Is everything okay?" So that says a lot from a family-owned organization where they know not only the patient and client, but they also know the family members. And I said, yes, my father's fine. He's just having dental work. And they were like, he's always here at clockwork at a certain time in the morning. So, but that says a lot about the
It
caring
does.
and the empathy and
And it's
compassion.
good to know that.
Yes,
It's good to
very
know
much
things
so.
like this.
What's nice also is if you went to the nursing center at Shrewsbury and you went for short term, again, we'll use the broken hip scenario. And then you were discharged home, and you might go home with home care, hopefully accessible home care. And you needed to continue your PT, physical therapy, or occupational therapy, or speech therapy, depending on if you had a stroke or what have you. We actually have an outpatient clinic right at the nursing center. We have ample parking right in front for people attending the outpatient clinic. And they would have our same staff that they had for rehab when they were inpatient is the same staff that works at the outpatient clinic also. And what's nice is, I don't know if you've ever gone for physical therapy over the years, but sometimes you'll go in and there'll be, the physical therapist will have yourself and 4 other clients at the same time, and they'll say, okay, go on this machine and do these many reps. And then you finish and you're looking around going, where are they? I can't find my physical therapist. What's nice is at Shrewsbury's outpatient center is it's one-on-one, so you don't have any other disruptions. It's just that physical therapist and yourself going through your rehab, which is really nice.
And why else, what other reasons would you go to the clinic for? Just give me another
Well, you would go for
example.
speech. So let's say you had a
Speech,
stroke
sure,
and you
yeah.
had some paralysis, and you're working on your swallowing or working on your walking, so you would go for speech therapy for your voice, and you would go for occupational therapy as well as physical therapy, or You know, if you've had any broken orthopedic situations that have occurred, or a heart attack, cardiac, or COPD, any of those, a lot of times, you know, to get you back, you're deconditioned, so get you back to a baseline and get you back conditioned. As you know, you teach a lot of yoga
I
and
do.
exercise, and
yeah.
unfortunately, there's certain generations that when they've reached a certain age, they don't want to work out
That's
anymore. And then they have to get back to, when you go to rehab, it's a workout.
That's right.
You
There
know.
is life after retirement, though.
There
There's a
is.
lot we can still do.
There
As
is.
I said, it is an aging population. I noticed something in the brochure that kind of caught my eye, and I'd like you to just tell me a little bit about it. Intergenerational activities. Can you give me an example of what that is exactly?
So on the campus that we're at in Julio Drive in Shrewsbury, we work with a lot of the school systems.
Oh,
So they
good.
bring the kids come in, and then also in the high school, they have to get so many credits for their graduation. So they come in and volunteer in activities.
That's a great
And
program.
then we have
yeah.
different programs at the holidays where we'll have Santa and the kids from the neighborhood and the town can come in, and we have different programs. And we've actually developed some programs with the Shrewsbury Housing Authority. So we go in once a month and we do blood pressure clinics. We're actually doing one right now as I'm not there because I'm here. We do blood pressure clinics at the 3 different housing authorities apartments in the town of Shrewsbury. So, and then we're doing a lot of programs at the different senior centers, including Shrewsbury Senior Center, where you and I met originally.
I was so impressed with
Yeah.
her.
Thank you.
So knowledgeable.
And we do a lot with the memory programs that they have there, the memory cafes that they have. We do some sponsorships, and we also do other educational programs there. So we do, our rehab team goes out and does a lot of balance programs and fall
Really
prevention
important. Oh,
programs.
yes.
And we take that out to the different senior centers, so we've been doing that monthly. As well as I developed a program where I put together, and it's called, we're going out to the different senior centers. We just did one yesterday at Sutton Senior Center, and we have one in Shrewsbury in May. And we go out, and it's a roundtable group of professionals in the healthcare industry. So hospice is there, representative from hospice, representative for home care, assisted living, the PACE program, and nursing homes. And we go out and we do a program talking about generalization of this is what this is. And so people can get educated on and gather information so that they have the knowledge. So when that crisis does occur, because it does happen, as we know, life gets in the way.
Very unexpected.
Right, and all of a sudden you find your house, you find your health deteriorated, or you're a caretaker for a loved one and they're in the hospital and they're saying, they're being discharged in 3 days, what are you going to do? What direction are you going to go with for your loved one or yourself? So we go out and we do educational format program presenting the different representatives of the different services
so
out there.
important.
And it's been well received, and the different senior centers that
Is
we've
there a
been
name
doing.
for this? A specific?
So we're calling it Navigating the Healthcare Highway. What are my options?
Wonderful.
So, yeah.
Well, we've got about 3 minutes left.
Okay.
What else do we need to know? I know, there's so many
I
things.
know.
I wish it was live and you could ask questions. And
Yeah.
maybe someday we'll do that on this
That would
show.
be
Wouldn't that
nice.
be
Yeah,
nice?
that would be
Have
fun.
people phone in?
Accessible Home Care is doing some outreach programs also in the community. We're doing a program, and it's called for veterans. It's called the Aid and Attendance, which is a national veterans program, and that they can receive financial help through the VA for home care, for assisted living, for nursing homes, what have you. And we're doing a couple breakout sessions at the different senior centers. It's on our website for Accessible Home Care, but we're doing them in Grafton, in Sutton, in Charlton, and Webster at the senior centers in May. We actually have a real Major Jones is presenting the program. So, and it's how the surviving spouse or the spouse or the whoever was in the armed forces, be it the husband or be it the wife or be both, or a surviving spouse, can access financials for home care coverage, which is nice.
My head is spinning right now. And I know as soon as you leave, I'm going to say, what else should I have asked her? Again, we've got about maybe a minute and a half left. I want to thank you for
You're
coming,
welcome.
by the way.
Thank you.
And knowing you, you're probably always still learning new things too. So it's important for you folks to keep up to. So keep that in mind. Take a course, go online, give Lynn a call. Lynn, do you want to leave any kind
Absolutely,
of a website,
sure.
phone number,
I'll leave
anything?
some numbers. And we were just having this conversation.
Yeah.
That no one memorizes numbers anymore. If you lose your phone, you forget everybody's numbers, where before you would know,
Right.
everyone's number.
Right.
So Shrewsbury Nursing and Rehab, the best way to reach myself is the telephone number is 508-845-6786. And accessible home health care, the best way to reach me is office is 508-859-1644. And again, my name is Lynn Alexandrowicz, or you could speak to the admissions department at Shrewsbury Nursing Center. And at Accessible Home Care, all our staff in our office are just as knowledgeable as I am.
Wonderful. When do you rest?
I don't.
But
I have about 4 hours of sleep a night.
Is that all? And you get up chipper and raring to go.
Yes, yes.
But,
And we're all caretakers, as you know, we've all
Yes, we
experienced
are,
that
aren't
in
we?
life.
Although I guess there are men that do that too, but I think it usually lies
Right.
on the shoulders of women. I
And
want to thank you.
children.
Yes, and thank you again for
Thank you
coming
so
in.
much.
You're
I
wonderful.
appreciate it.
You'll
Thank
have
you.
to come back.
I would love to
because
come
I
back.
did not memorize all of this.
Okay.
I don't know if you did, but get in touch with her, and she'll be glad to help you. And thanks again for joining us, and we'll see you next time with another exciting show. Bye for now.
Thank you.